knowing that we have a certain section that is going to be covered by these doctors, by the health workers that are going to these facilities for free. And we feel like this has gone on too long and we're being taken for granted. So this is, we're speaking to both sides, both the welfare of the doctors and also the benchmark of the healthcare delivery. It's not supposed to rest on free labor.
Welcome all of you to this podcast. My name is Professor Wilbroad. As usual, we want to bring you important topics that affect you or affect our people in Zambia and even across the world. And today I wanted to talk to one of the most important topics that is running around in Zambia, especially where we have got an issue with doctors, especially those that are volunteering in the health system. And we wanted to find out their leaders, the team that is helping these people find jobs, get into places of comfort. What are they thinking about them? And there's an announcement just came in. So before I say everything, let me first introduce my guest today, Dr. Chibwe. Welcome.
Thank you, Prof. Thank you for the invitation.
You're welcome here because I wanted to hear a little bit about yourself. Who is Dr. Chibwe? And then we can go into your subject matter for today.
Well, I think I'm a simple doctor practicing at Chawama First Level Hospital, and I happen to be the current RDZ president. I think that's yes.
So why did you join the RDA presidency? You know what it takes. It's going for government, going for your own colleagues. Like, how are you managing? What motivated you to do this work?
Well, personally, I'm just a month in office, by the way, Prof. I saw growing concern of lack of engagement with our stakeholders, and this, to be specific, is the Ministry of Health. I think of late we've noticed there's a lack of engagement on various issues. To speak of an example is the past recruitment, where we saw, instead of matters being resolved on the tables, we had back and forth exchange in the media, where the ministry would say this and SEC would comment on the issue, and this is quite different from the norm that we know as doctors and among stakeholders who are the Ministry of Health team.
Excellent. All right, so now, Dr. Chibwe, let's go into the elephant in the room. So your organization, the RDAZ, which I'm also used to be a member of now, I think that we are growing old, but which we also feel is an important organization, has just declared that we can withdraw now from the 2nd of June some of the services that volunteer doctors are giving. Why did you decide to do that? Why did you take that step?
I think in the past, especially with tables to discuss recruitments and employment of doctors, we've always speak to the doctor-patient ratio in the country, which is not been addressed over the years, and this has become a theory. As when you go down to these facilities, we have these gaps that are being covered by the doctors volunteering. We thought this has taken away the leverage that we're supposed to use with the government, and that leverage is supposed to be felt when you have, because we don't have patients that are going to these facilities and give feedback to government that there are long queues, because we don't have superintendents discussing in these management meetings that we need workforce. Everything has continued to go business as usual when we have our colleagues who are, apart from, right now we are aware, Prof, that now we have a lot of medical schools, private ones. These need fees. So these colleagues paid school fees for over 7 years. Some of them may have gotten loans in the name of paying back after school. But will you find the situation where these doctors now are forced to go back home and still ask for more money to move from home to these facilities, provide lunch when you're on call? You have to be in the hospital from 8 to 8 the following day, meaning they have to feed themselves breakfast, lunch, and supper. Look at the risks. Where we have infectious risks. So meaning if these colleagues get sick, it's up to the families to take care of them minus pay. Talk of medical legal issues. We have doctors in court who are being supported by legal aid because they can't afford a lawyer, and some of these doctors got sued while in these facilities offering free labor. I think these are some of the issues that we feel as an association can't go business as usual, minus us stepping forward to bring all these issues to light.
Okay, thank you so much for that response, Doc. But I wanted to ask you if there are different stakeholders, and I'm not playing which side of this, but I just wanted to make sure that we are taking each. That's the concerns of the doctors and also your team, that we are being abused. We think we are offering an important service and leverage is taken away from us. So that's an issue we're concerned about. But I wanted to also bring in the other stakeholders. And I think in your discussion you have engaged with the government, other leaders in the health system, is that by you declaring that there is going to be this strike, or not strike, a withdrawal of labor in a way, you are creating a crisis in the health system. How do you respond to that?
Well, the crisis is already there, Prof. Except we have our colleagues that are masking it. And masking, isn't the way to go. The crisis is there and it's been there for some time. If you look at our mandate, I think this matter has two sides. So for RDSZ, we're looking at the welfare of doctors, and then at the same time, we're looking at the healthcare delivery in the country. There's a crisis that is being masked. So we have a concern that government is while they're doing their budgetary allocations, we're allocating not based on the needs assessment. We're allocating based on what we feel is adequate at that particular point, knowing that we have a certain section that is going to be covered by these doctors, by the health workers that are going to these facilities for free. And we feel like this has gone on too long and we're being taken for granted. So we're speaking to both sides, both the welfare of the doctors and also the benchmark of the healthcare delivery. It's not supposed to rest on free labor. It's a crisis that has been there, and we're just trying to remove the mask of the crisis and have government to come in and address the crisis.
So when you do something like this, that's another stakeholder for the leaders that are supporting you. But another group are the patients. What do you think patients should think about this kind of thing, which is happening, the tug of war? There's government saying they can't employ the doctors. You are saying we can't volunteer, but there's a patient in the center. How should patients look at this?
Well, first of all, I think the public, and in this case patients, should commend the doctors. I've followed most of the comments on social media. Public was not aware that we have doctors who volunteer in these facilities. Because when you look at the work culture, you can't tell. These doctors wake up and show up as if they're being paid. And that's very commendable. But the thing is, someone has to speak for these doctors. It's a passionate job. We wake up to save lives, but someone has to save these doctors for them to save lives as well. I feel the public, the patients should be on our side to know that, first of all, we've held the system for years. We have doctors who are still on the streets for over 4 years. These doctors, they are not home. They keep showing up despite being left out on past recruitments, yet they show up. And this is supposed to be commendable by everyone. Government, patients, every stakeholder is supposed to commend these doctors. But we can't still keep doing this. In the past we've had doctors, out of passion. And if Prof, me, I'm not as old as you, but you can agree with me that in the past we had these doctors who used to practice as a way of giving back to society. These doctors had money. They were rich people. Dynamics now change. We have, very young doctors who've gone to school, and after that, they were the one to start families. They are breadwinners. Their siblings have been waiting to be supported by them. They have to pay rent. In one of the discussions, I was told, don't you think it's a noble cause? It's a calling. And my response was, if it was a calling, I think we would have gone through med school for free and would have been walking into grocery stores and pick up whatever things that we want for free. Would have been not paying rent because it's a calling. But even then, our colleagues from the Catholic Church, nuns and priests, they get supported. Their families are taken to school. They receive rations and whatnot. And that's what we're asking. This is what we deserve in as far as we ventured into this noble profession.
Very important point. So I wanted to also think about some of the things that people have blamed to say that, okay, the government can't employ all the doctors. You are over 2,000 and the schools are overproducing. What's your comment to that?
I think the most important thing is the system saturated, Prof? I don't think the system is saturated. We're not saying we have too many doctors on the streets. We're saying we don't have too many doctors in the system. And that's why, if you follow the discussion, there was a letter that was sent to our office stating that we're advocating for disruption of service. The fact that ministry has acknowledged the disruption, meaning the system has been resting on free labor. And this is not what we want to accept. No. Yes.
Okay, one more point and then we'll take a break, and then I think I want us to talk about the solutions. But for now, I wanted to ask you, I've read some of the comments on social media and some of the people I think I know from the public, some of them, they were mentioning that what is special about doctors? Because they think that they can control everyone. What is special about doctors? Should also engineers and others do the same thing?
Well, Prof, I don't think we have a lot of engineers that are in government institutions offering free labor. I think the culprit is the health sector, and to speak within the health sector, I think we're not saying nurses don't deserve employment, pharmacists and whatnot. Our mandate is to speak for the doctors, and we'll speak on that. The rest of the cadres of the profession, if they feel this is something that is serious to them, they can also speak. To these cadres, our fellow cadres, I think our appeal is the best they can do is offer solidarity. The least they can do is let the agenda go, as this agenda is being addressed to our employer. And we are not saying we're entitled to a standard. We're just speaking to what we feel we deserve. We don't deserve to hold the system for free. No. And that's why we're pulling out. We haven't gone ahead as far as protesting the facilities, disrupting the health care of patients by the people that have been mandated to be in these facilities. No, we're simply saying, in the first place, we're supposed to be home, and that's why we're going back till government feels like we need to go back to these hospitals on paid up positions. Then we're going to have these doctors go back. So it's not coming from a point of self-entitlement. We're just simply saying we're tired of showing up every day, and the system is resting on us, and we feel like this is not. It's becoming a normal, business as usual to our employer.
Excellent. So thank you so much, Dr. Chibwe, for speaking to the doctors' issues, speaking to the health system issues, and speaking to the importance of our patients out there to support the doctors in this struggle to make the health better. My understanding and summary of what you have said is that there's a health system that needs to deliver a service, and there are ingredients to that system. And some of the ingredients are the doctors, and some of the ingredients is the finance to support the system itself. And so you can't have those come together without financing. Actually, you will be abusing one group, if not taking them for granted, if you expect them to shoulder the burden of the whole health system without pay. That's your argument. I also agree with you that that's really important to the leaders, anyone listening to us, that we have got a duty to protect our health systems, protect not just doctors, but anyone working in the health system. And for the people out there, you have got sides to take, but in the end, you also would be a patient or your relative. You want a functional health system. So let's take everyone to account for this, and hopefully that a solution will be found. Join me in the next episode, because I want to explore with Dr. Chibwe what are some of the solutions that they can bring as RDAZ. What can government do realistically, given the physical difficulties that they are facing as well, and also the Ministry of Health leaders. We do have leaders there, ministers, permanent secretaries. What can they do? And for you also want to also ask, can the patients do anything? So join me in the next episode.
Think Talk with Professor Wilbroad.